Assalamu alaikum. Good afternoon, everyone. This is the second lecture of cardiac MRI in cardiomyopathies. This patient is 18 years old, male, of African origin, who presented with recurrent syncopal attacks, starting with the long axes to the 3-chamber view and the 4-chamber view. As you may see, preserved systolic function, no evidence of any systolic stenotic jets or regurgitation jets, no SAM was detected, but there have been mild concentric and symmetrical hypertrophy of the left ventricle. There was no evidence, or there was no history, family history of any ARVCs, no history of hypertension, and there was no evidence of sudden cardiac death in the family. No cardiomyopathies was known in the patient's history. Function again was preserved systolic and radial functions. No abnormal wall motions were detected. End diastolic volume was at the highest normal limit for the body surface area. And again, there was no valvular regurgitation. T2 maps and T1 maps, both of them measured in the different segments, were within the normal values. So this is, for example, the T1 map was within normal, so there was no any changes on the native T1 map, which, as a matter of fact, was matching what we saw later on in the late enhancement, because there was no evidence of any fibrosis on the 4-chamber or the 2-chamber views, as well as there was no evidence of any late enhancement in the short axis. So in absence of a history of hypertension and no valvular diseases, no family history of cardiomyopathies or sudden cardiac death, the differential diagnosis was narrowed down whether this patient was using a kind of anabolics, or the patient might be an athlete. Misuse or toxic heart or cardiomyopathy due to steroid use or anabolics usually would there would be some changes in the form of borderline normal or borderline slightly impaired systolic function, which was not the case in this MRI, but the function was preserved and the systolic function was good. So the differential diagnosis was narrowed down towards an athlete heart. Taking or digging deeper in the history, it turned out that this patient was an athlete that was not provided in the MRI or in the history during or in the request of this MRI, which might confirm that those changes have been due to athlete heart. The patient later on got or received an ICD because of the episodal attacks that he experienced. Thank you.